Renal 2 case study. The client is an 84-year-old female who arrived to the emergency department from a nursing home where caregivers report that she has an altered mental status, confusion, and weakness that they just noticed this morning. Vital signs: heart rate is 122, respirs are 24, her blood pressure is 92/58, and her SaO2 is 92%. Temp 103.6. She's incontinent of urine, and the nurse notes a foul, sour odor to the urine. We need to be looking at this altered mental status and confusion, her weakness, her elevated heart rate and respiratory rate, the low blood pressure, the low oxygen saturation, that elevated temp, incontinence, and that foul odor to the urine. With the altered mental status and confusion, this could be caused by delirium or potentially dementia, although it does not mention that. Medications. Her weakness might be caused by poor nutrition, an illness or an infection, depression, and a sedentary lifestyle. That elevated heart rate, potentially fluid imbalances, or maybe a respiratory or cardiac illness, or other illness and infection. The elevated respiratory rate, fluid imbalances, might be caused by cardiac or respiratory illnesses, respiratory infections, hypoxia, the low blood pressure, potentially fluid imbalance, medications, shock, and her low oxygen saturation, anemia, hypoxia, that cardiac or respiratory illness or respiratory infection, and the elevated temperature, definitely illness or an infection, overexertion, the environment, maybe it's just too doggone warm, too many layers, whether it's bedding or clothing, incontinence, UTI, there might be weakened perineal muscles, or dementia. People who have chronic confusion are often incontinent because they just do not recognize the need to void. A foul odor to the urine might be caused from a UTI or a diet or chronic kidney disease. Dehydration. For the altered mental status and confusion, we definitely need to be reorienting this client and observing closely, offering minimal choices, and never argue with the client. As far as weakness, that rest balanced with exercise, making sure the client is eating appropriately, and let's check and make sure there's nothing else going on with this client that we need to be focusing on. For the heart rate, make sure there's plenty of fluids, but at the same time, make sure there's not too many fluids. We need to maybe give medications and do diagnostics for other potential issues. For that elevated respiratory rate, deep breathing exercises or that pursed-lipped breathing, let's slow them down. Give them some oxygen, elevate the head, maybe the bronchodilators. For the low blood pressure, Let's make sure they have enough fluids on board. We may have to give medications to bring it up. Put them in an appropriate position. Excuse me. Low oxygen saturation. Let's give them oxygen. Elevate the head of the bed and do diagnostics for other potential issues going on. For her elevated temperature, let's cool things down. Wear that lightweight clothing. Remove layers. Do some diagnostics for illness or infection. We may have to give some antipyretics also. The incontinence, well, Kegel exercises, strengthen those muscles, or do bladder training. Make sure that we're using those incontinent pads or garments. We also need to make sure that there's not a UTI, so doing a UA and a culture. And if there is, give antibiotics. That foul odor to the urine, make sure the client's getting enough fluids. Doing that UA and culture, and antibiotics if there is an infection. And doing a diet review. Maybe there is something in the diet that's causing that foul odor.